Thank you all so much for joining today. This is a special community of practice that we're having today. We are recording and it will be uploaded to our PFCC Partners YouTube channel. We also have live transcript available. If you have not already subscribed to our YouTube channel, please go ahead and do so. You'll have access to this workshop as well as to past and future workshops. So many of you are familiar with PFCC Partners, but in case you are new to us, let me share with you, this is who we are. This is what PFCC Partners is all about. We want to see the health system transformed into one that works with people and through communities as partners and their well-being. We catalyze system improvements by engaging the human experience of health to improve health outcomes for all. These have been our values since we opened in 2010 and still guide our interactions and partnerships today. Excuse me. So we know that the healthcare system is complex, it's difficult to navigate, and even more so difficult to change. We recognize that complexity is layered into the multiple systems of the healthcare environment, and that's what makes it so hard to change. Through PFCC Partners, we open space within the system for patients and family caregivers to drive improvements. We collaborate with health systems, federal partners, research teams, and others to develop the infrastructure for high value and productive partnerships with patients and family caregivers to drive and improve outcomes. Once we open this space, we fill the space with the PFA network, which is filled with people, stories, and insights. We have the PFA network is filled with over 1,100 diverse patient family partners that are ready, willing, and able to collaborate with our health system partners, where they have ready access to communities representing diverse needs and experiences within the health system. So that's a bit about PFCC Partners, who we are, how we operate, and who we're working with. So I'm so excited to share and to have Camden Coalition representation here today. So our topic today is building power and shaping systems, the Camden Coalition's approach to transform health and social care through the National Consumer Scholars Program. I'm excited to share that we have Evelyn Kane, who is the Associate Director of Community Engagement and Capacity Building, as well as two consumer scholar alums, Aricelis Quiones and Aria Garvin. Evelyn, you can take that down and you can start sharing your screen. So glad to have you all and passing it to you.
Thank you so much for having us. We're really excited to be here. Let me get my slides situated. Okay. There we go. Everyone's seeing those okay? Cool. Okay. Yeah, again, I'm Evelyn. I'm really happy to be here. Thanks, PFCC Partners. We always love literally anything you ask us to do. We love it. So I'm happy to be here, and I'm happy to be here with Aracelis and Aria. Um, I'm going to kick us off talking a little bit about the coalition, background on the Consumer Scholars Program. I'll invite Aria and Aracelis into the conversation. We'll talk a little bit about program impacts and some of the lessons learned, some of the things we've taken from the program, both the Camden Coalition as an organization and then like us as people. We have a small group, so I would totally welcome folks to, if you have like questions or comments, feel free to jump in as we go. It's not always easy to see the chat when you're screen sharing, so either feel free just to raise hand or come off of mute, or if someone can help keep an eye on the chat, happy to respond to things as we go. So a little context just about the Camden Coalition for folks who aren't familiar. The coalition is a multidisciplinary nonprofit. We're located in Camden, New Jersey. We've been around for about 20 years. We got our start when our founder, Dr. Jeffrey Brenner, who was a primary care doctor in Camden, noticed that there was like a relatively small number of people in the community who were using a lot of emergency department services. And so he and his team pioneered a few things. One was the healthcare hotspotting model that some folks may have heard about. There was like a lot of kind of national attention about the model back when it was emerging. And so this was the idea of using data from electronic health records to identify specifically who these folks were who were coming in and out of the emergency department. At the time, we talked about it a lot in terms of like cost savings for healthcare systems. But then also, even, at the earliest stages, the coalition team was also recognizing that, like, whoa, for these people, something is not going on. They think what should be going on is not going on for them in terms of managing their like health and social needs. And then at the same time, the coalition started a care management model that's part of what we still use called the Camden Core model, which was one of the early models that was recognizing how social determinants of health, as we, now call it, um, intersect with people's health. And so, at this point, 20 years ago, to be like, maybe the fact that someone doesn't have stable housing has a direct implication to their like medical health was still kind of like a new and emerging thing to say. And now, thankfully, it's like pretty common sense. And so, now the coalition, our mission is related to improving health and well-being for people with complex needs by advancing what we talk about as equitable ecosystems of care. So we've really evolved our language to think about how everything within a community, you could think about it geographically, the health systems, the social care systems, the housing availability, community supports, connectedness, like all the things that are interrelated, how that all impacts people's health and well-being, and how can we think about not just a specific program or specific organization, but really to zoom out and see like what's the ecosystem of health here? How are all these pieces connected or not connected? How can we reduce fragmentation? How can we reduce silos? How can we center care based on people's human experience, which is as a human being, you're rarely thinking about this need lives in this very specific box in my life. And then all these other needs, they live on different specific boxes. Like we all just experience things as like, interrelated experiences and how can our systems reflect that as well. So that's a little bit about the coalition. Just to give you some context, community engagement, so the work of organizations partnering with people with lived experience has been a long-standing value that our organization has. It's a through line across our work. So we do work ranging from like hyper-local work in Camden, New Jersey. We still have care management programs. We still work with folks navigating complexities in the community through our care teams. We have like population health and community health programs in New Jersey. So we work on things like substance use, maternal health throughout South New Jersey, but then the state as well. And then we also have a national center for complex health and social needs where we do field building. So bringing folks together to be like, we don't have to all reinvent the wheel when we're working on maybe similar and related issues. We put on a conference, we do training and technical assistance, and all through from our local work to our national work, we think about how are the people living the reality of these issues being centered in the work itself, and how are we amplifying those voices and experience in everything from program planning and design to how we run programs to how we work with folks in TA arrangements, technical assistance arrangements to how we do evaluation. And so we have an array of what we think about as like our community engagement programs that my team oversees. So locally, we have a community advisory committee that's made up of folks who live in our local community, lots of people who have graduated our care management program or like folks who are part of our Housing First program sit on the CAC. It's an official part of the coalition's governance structure. So it's a committee of the board, and then our CAC leadership and a couple other designees from the committee sit on our board of directors. So it's like integrated into the organization's decision-making and governance structure. The CAC helped us to start our community ambassador program. I'll just real quickly, I love like the origin story of the ambassadors, which was in 2020, we were working with our CAC around the upcoming census, and CAC members were really excited about the opportunity to do some census like ambassadorship, like going out, making sure that the count in Camden was happening, because Camden isn't a like often undercounted community, which has all sorts of implications for funding and representation. And then COVID hit, and we said, "Whoa, we got to put this census ambassador thing on hold while we like figure, what's going on." And our CAC member said, no, actually, we're just going to pivot. Like, we might not be focusing exclusively on the census, but everything we've been doing, and as far as building out this trusted messenger model, is so relevant right now to talk about testing sites and, upcoming vaccines when that was coming down the pike and availability of social services. So our CAC helped to really create this model that we still operate. And then on the national side, we have our Consumer Scholars Program, which we're going to talk about. We run it's our Consumer Voices Bureau, Amplify, which operates like a speakers bureau. I'm not going to talk about it too much today, but all these programs have a web page that you can check out more information on. And then the coalition and PFCC partners and a few other organizational partners, as well as a team of folks with lived experience from around the country, are part of a national partnership called Inspire, where we work to initiate strategies to advance the practice of authentic community engagement in healthcare. And then we also do a lot of work in our community engagement team related to like TA and training and field building activities to support other folks in their community engagement practices. So the Consumer Scholars Program, which we're here to talk about. Um, the Consumer Scholars Program started in 2016. I joined the coalition in 2019. And so the first few years of the Consumer Scholars Program, the idea was that the coalition was putting on this national conference, Putting Care at the Center, which I'm actually going to do my due diligence and I'll plug it. I always forget to do this. And honestly, like Lindsay and the PFCC Partners team pick up my slack on this, but I got it this time. So if anyone's interested, the conference is going on Portland, Oregon, October. We have just a very small number of tickets left, so you can still register if you're interested. But so we have been putting on this conference for many years, and there was real interest in the earliest days of ensuring that people with lived experience were at the conference. And so part of the origin of the program and why we talk about it as still as Consumer Scholars is it was a scholarship program to bring people with lived experience to the conference. And we had some programming for folks who received the scholarship. We convened the group of scholars at the conference, but it was this one-off type of thing. Brought folks to the conference, tried to stay in touch, et cetera. And then right as I was coming onto the coalition in 2019, we had received some funding to build out the program and think about it as a peer-led training and leadership development cohort model that still included participation in the conference, but also was meant to really bring people together for a longer period of time around training, capacity building, network building, to say there's so many ways that people with lived experience can be engaged in complex care. But there's like a few things that we can solve for, which is a lot of folks who are doing this work in their community are like Araceli's, like Aria. Not everyone has the same kind of access to national level types of work and opportunities. I would say the majority of our consumer scholars are people who are very well plugged in locally in their city, in their community, sometimes throughout the state, but kind of making that next jump to plug into what we were thinking about at this time is like building out the national complex care community and wanting folks with lived experience to be part of that. And then also just like training and capacity building. I mean, I think also it's common for a lot of consumer scholars to come in and say, like, I'm doing this work, but like no one's ever trained me to be an advocate, or no one's ever like trained me to do advising. Like I'm just making it up as I go along. And sometimes I don't always feel like super secure that, and like how I'm approaching things or how I'm navigating these spaces. I'm just doing it. And to bring people together for community and to say, like, we can give you some tools in your toolbox. And so that was the other piece behind the build out in 2019. And so since then, we've had several cohorts under this like newer model where it's not just conference participation, it's broader than that. And so we bring together groups of folks who work with us for about 16 to 18 months. We have a whole curriculum of peer learning opportunities. So we have like consumer scholar alumni who come and run different sessions. We just did a peer learning session around self-care practices for people with lived experience. We've had peer learning sessions related to advocacy, involvement in research and measurement projects. So we have so many people now in our alumni base who are in all the different corners of like what it means to be an advocate or advisor with lived experience. And so we can bring people in to really talk about these different pathways that they are familiar with, that other people can access. We provide some training, such as like a storytelling training that we do with a wonderful organization, Storytellers for Change. And then also just support folks in some hands-on learning. Yeah. Oh, Roger, did you have a question? I saw your hand up. I saw a couple things in the chat too, I think.
Yeah, because I was gonna apply for that, but it said that they had to be on Medicare and Medicaid, both.
Great. Yeah, great question. So you're one slide ahead of me. So I'll talk about that in just a second, and clarify that. Yeah, I'll just finish real quick. So the program includes these training, peer learning opportunities. We have folks, the consumer scholars attend and participate in the annual conference. The cohort usually runs from like kind of kicks off at one conference. So like we'll have a group kicking off their participation at this conference and then capstones at the conference the following year. And so especially at the second time people come to the conference, we have lots of opportunities to think about people submitting workshops, beehives, story sharing sessions. We also try to really ensure you're not just like there as a participant if you want to be doing something more. And then, as I mentioned, what we think about is like hands-on learning opportunities for consumer scholars to work on projects with staff at the coalition that hopefully benefit folks in terms of just like real, like hands-on type of experience, but then also tremendously benefit my colleagues at the coalition who get, people who are partnering in their work and adding a lot of value. And then to your questions, I think there was one in the chat about this too. So this cohort that just started with us last month and will be working with us through the end of 2026 is the first time that we've had a specific population focus. And so for this year's group, everyone is dually eligible for Medicare and Medicaid or a family caregiver for someone who's dually eligible. Past groups of consumer scholars, it's always just been open to anyone who identifies as lived experience with complex health and social needs or a family caregiver for someone with complex health and social needs. So pretty broad definition. This year, I feel like it's, I don't know, just kind of fortuitous. Like we had a funder who was interested in the program, and this was back pre-election that we were having conversations with this funder who did a lot of work in the Medicare Medicaid space and was saying it's really hard for us to find people with lived experience who are dually eligible, but like also are like able to navigate policy and like advocacy conversations. And we just keep going to the same people over and over, and we want to build the network. And we said, oh, we could help you with that. We would pioneer like a specific population. And so it's the first year the cohort's been specific to Medicare and Medicaid. I have no idea if we'll in the future if we'll open it back up or if maybe we'll experiment with other specific populations. So that's something new to us this year. And then the last piece I'll say here before I ask Ari and Araceli's to join the conversation is just a little context for who consumer scholars are, the makeup of the cohorts. So each cohort is between 12 and 15 individuals. Like I mentioned, this year it's specific to people who are eligible for both Medicare and Medicaid, dually eligible folks. Past years, it's just been open to people who identify as lived experience with complex health and social needs for themselves or as caregivers. We do ask for folks to have some experience, come in with some experience using their lived experience as an advocate, as an advisor. There's a big range in this, but we kind of believe the Consumer Scholars Program is not like the best first rodeo. It's really for folks who have some context for community engagement work. Like I said, most people come in, they're really well plugged in locally or not, or on a state level, but are just like looking to kind of take the next step. And so that's where the program comes in at. And then the other thing we think about is diversity, which is part of the hardest part of the selection process is like we often get so many people who are really, really good candidates. And then we have to kind of take a step back and say like, okay, what's the overall makeup of this cohort in terms of geography and age and race and lived experience and professional experience and all of that. Because we know both it's important to ensure that there's like pathways for representation and because we know that people benefit so much from the diversity of the group. So I'm going to pause there and I would love to maybe Aria, just because you're on top in my Zoom box, I would love to invite you if you want to introduce yourself, anything you want to share about your background, work, lived experience, and then say a little bit about kind of like how you came to the program, how'd you hear about it, why'd you think about applying? That would be awesome. And then Araceli, you can do the same if you don't mind.
Awesome. So I'm Aria Shelton. I'm from Central Illinois. So if you know the University of Illinois, Urbana-Champaign, that's where I live, and it's in Urbana, Fighting Illini. Um, I I was on a family advisory board through a medical waiver for kids who have complex medical needs. So I have a son who's right here, who has a trach and a G tube, and we generally have home nursing care. His nurse is actually hurt right now. She hurt herself at another client's, and so I am working from home and nursing this kid and doing all the things right now. So, that's how I heard about the Camden Coalition. Evelyn, turn that down, please. Evelyn had came to our family advisory board meeting and she was like telling us about the program, and I was definitely like in my mind like, you know what, like I want to be able to use my voice on a larger scale and a larger level, other than just within the state of Illinois. And so I applied and interviewed, and it was wonderful opportunity to be a part of a group of people who are super diverse, in like capabilities and background. So one of the things, my son uses a communication device to talk, and there was a young lady in our cohort that she actually is an adult. She lives on her own, and she actually uses a communication device to talk and live her life. And there's so many times that that just like inspired me and encouraged me that like even if my son doesn't ever speak, like he can still have this full and amazing life and do all of these things. And so it was just amazing to be a part of the cohort with her in there. And like, I've shared it with her, but I don't know that she understands, like that she knows how much it actually impacted me to be able to have her presence and doing those things. And so I think it's those unintentional things that happen. Some of the things that are very intentional that happen that I really appreciate were that I got to be able to like sharpen my skill set on sharing my story in a way that is effective. Can you turn that down a little bit? You keep turning it up. Thank you. Don't turn it up. And then he loves Cat in the Hat. So that's what he's like watching right now. So but yeah, it was a way, I've shared my story like through we've done a Make-A-Wish trip. I've shared my story, like they have our local ambulance team has had to drive us across states and stuff when he was really little. And so I've spoken at fundraisers for them to get pediatric ambulances. And so I've been able to share my story in ways that allow for um change to happen, but it was a nice to get an to actually have like some professional training in that. And so like Jose, one of the gentlemen that like worked with the Camden Coalition, that was part of it. Is like here's how you do story mapping. Here's how like what are you trying to convey in this? And one of the things that I really appreciated about him, especially as like a mother that is a caregiver, like I have my story as mom, and I don't want to share my son's story because that's his story. And so that is one of the conversations that him and I had a lot, was just like, okay, but like I would tell the story, but it'd be more centered around Dominic and less centered around like me and my experience. And he's like, no, this is your story. So like share your part of the story. And so I really appreciated that and appreciated just the time to do that. And then also a part of the Camden Coalition, like when you're in the cohort, you go and you like kind of go into breakouts and you do group projects kind of. And so I'm the person that's like, I'm gonna choose things I really like, and then I'm gonna choose one thing that I don't care for at all. And usually like that's the one thing I get put in. And that's what happened here. And so like I'm super sketchbook, like I know we need research in the health field. Part of my struggle is like I don't need research to prove my experience. But along with that, they do need the research to be able to change people's experience and do the things. And so I've always questioned like, where do these numbers come from? Who's actually funding it? What are these things? And so it was nice to be a part of a research team and got to like take these courses through through one of the it was through Kansas City medical, to like be able to actually participate in some of the research study and like just the ethical classes you have to take and things like that. And so it was like to get that firsthand experience. I'm like, okay, not that people still can't jack with the numbers and do those things, but there is these levels of security and safety that they have put in place to try to ensure like that there is like when you're doing it through certain organizations or certain certified things, that there are ethics and there are like a board that you have to report to and these people. And so it was just nice to see all of those things kind of just come together and just being able to have a fuller understanding, be able to share my story in a more refined way, and just being able to get to know people. So those would be like my three big things that I took away from the Camden Coalition.
Thanks so much, Aria. Araceli, do you want to jump in?
Good afternoon. So my name is Aracelis Quiñones. I am from Puerto Rico, but I have been living in Queens, New York for the past almost 40 years. I am a woman living with HIV, living and aging with HIV and other comorbidities. I received my diagnosis 39 years ago, and my life experience has taught me resiliency and the importance of community because over the years I have faced challenges with health and stigma, but I also learned the value of advocacy and lifting our voices. And this is my second time as a consumer scholar, right? And I applied because I wanted to keep growing, connecting with others, and make sure that the experiences of people like me are included when decisions are being made. Um, Being part of the program was a great, powerful experience. Thank you, Evelyn. I learned so much, not just from the sessions, but from the other scholars. It's always good to learn from other people. We share our voices, and that is very important. And I also gained confidence. I learned new skills, and I could understand better how to bring in my life experience was going to make a statement in leadership and advocacy. And I'm going back to this program because, again, it gave me growth. And the first time there was a lot of confidence, and now I will be sharing my story on stage. And I know that our lived experience, our stories are so powerful. Everyone has a story, and every story is powerful. And I know that somebody in that audience, even if it's only one person, is going to be touched and identify with the story. The first time this program made a big impact on me, and believe it or not, because I've been on the doing this for so many years, but every time that I get to meet new people and do new things, it does made it helped me to find my voice. It helped me to understand better that I'm not the only one, and to learn that other people have stories that are going to make an impact on me also. And so many people, it gives me strength and the desire to keep coming back and keep sharing my story. The lessons that I learned are important, and I do believe that using our voices are always going to make changes. We just need to make it a reality. Thank you.
Thank you both so much for the comments. I really appreciate that you teed up perfectly where we're going next. So just to talk a little bit about program impact. So yeah, I really appreciate Aria and Araceli you highlighting what you took from the program. I want to share on kind of two levels. One is like some um, organizational impacts and like tangible deliverables, things that come from the work. But I actually want to start, I also want to say just like the impact it's had on me personally. So when I started at the coalition in 2019, my like sole job description was the Consumer Scholars Program. And now obviously it's like one of like 14 things I feel like I end up doing. But in the beginning, it was like, this is what I was here to do. And I came from, I was right before I was working with a community health worker program at a medical center in Philadelphia. And prior to that, I had been in like a nonprofit, like social service organization. And through, experiences, I was very committed to the concept of community engagement. I think especially working with community health workers, I was like deeply moved by like the the importance of people and communities being at the center of their own change, whether that's as a person bringing about the change you want to see for yourself, whether that's about like communities really being empowered to say, this is the vision we have for ourselves and we're part of bringing this about. And then when I came to my work at the coalition, I would say for like the first couple of weeks, I was like, I can't let anyone know that I have no idea what I'm doing here. I don't know if they know that they've hired the wrong person. I have a lot to learn. I just was like Googling like what is community engagement like frantically every day at my desk. And my first like year of working with the consumer scholars was so eye-opening, so educational. And I just like credit so much the folks who are part of that 2019-2020 cohort and teaching me, I feel like pretty much everything, like the 100% of my foundation of understanding community engagement came from my work with those folks. And part of that was like just navigating relationships and challenges and like the program. And on one of the reports that we have on this screen here, this exploring consumer engagement experiences, one of the projects that year was we had three consumer scholars, Stephanie, Suzette, and Olivia, worked with our research team, and they designed a survey to collect experiences of people who were doing community consumer engagement work. We often used the word consumer back then. What was like going well for them, what the barriers were, what the facilitators were. And then we also surveyed people in organizations and asked them, like, what type of community engagement are you doing? What are the barriers for the facilitators? And I felt like I learned so much from that survey and that research project around like what was challenging for folks. And I just continue to like, I just credit the consumer scholars with like everything I know pretty much. I learned so much from everyone I work with. And just really value, I think that organizations, one of my biggest takeaways is like, I just think organizations really consistently underestimate how much they can stand to learn from the folks they are providing services to, from the folks who live in the communities that they serve. And so often it's funny, like sometimes people kind of misunderstand what my job is at the coalition, and they'll be like, what do people think about like XYZ issue? And I'm like, well, I can't tell you that, but I can help you ask people what they think about that issue in a way that'll really be meaningful and a positive experience. But even, you know, I think recently it's come up that what a lot of organizations don't do, and what we could even do more at the Camden Coalition, is like be really intentional about evaluating your community engagement work itself, and like asking people who are part of your advisory committees, asking people who are showing up to work alongside of you, or even people who are responding to surveys, like, how is this going for you? Like, what could we be doing better to engage with you, to engage with others in the community? Like, we do so little evaluation of community engagement itself, and there's so much value there. And that's like been my first hand experience. And then the last thing I'll say on, you know, just like on the organizational level in terms of impacts is like one of the things that's so enormously beneficial to us about the Consumer Scholars Program. And, you know, this relates to like we have this ideal of mutual benefit, like consumer scholars or people who are showing up to engage, they get benefit. Organizations who are doing the engaging, they get real tangible benefit. We get so much real tangible benefit. I mean, all of these things you're looking at on the screen are things that if not for consumer scholars, we could not have done. We have consumer scholars run webinars and do workshop sessions at our conference, author reports. We did this project that I'll call out Naomi was a part of, this policy project where we did some story collection and policy recommendations around compensating people who do community engagement work but receive public benefits. Our whole program Amplify, where we do this partnership building between people with lived experience and organizations, that could not exist if not for the Consumer Scholars Program and the relationships we build with people who then go on to become amplifiers. So much of the advising work that we do, again, is really drawn from our like hands-on experience doing the work. And the Consumer Scholars Program is such a important way that we're like actually doing the work of community engagement, building relationships with people all across the country, working together, navigating challenges, navigating personal circumstances, figuring out how to bring really diverse groups of people together in meaningful ways, thinking about accessibility. I mean, until you have attempted to work with like bring 15 people from across the country with all sorts of life circumstances and medical issues and disabilities to a conference, which is not inherently an accessible situation, and like get people on planes and through the craziness of what hotels tell you is accessible. And then when you show up, what the reality of it is. I mean, I've had so many eye-opening experiences that me as an able-bodied person could have never understood how frustrating it is, where the system tells you, sure, there's like this is fine and this is like accounted for and no problem. And then you get there and it's actually a huge problem that you have to, figure out. And so just like all of that work and then taking the time to like reflect and think about what have we learned from this? How can we do better? How can we just talk about these issues, even if it's not something we can fix? All of those have made me better at my job. I feel like I'm maybe a better person, have certainly made the coalition a better organization. So we get
There was
tremendous
a question
benefit.
in the chat, Evelyn.
Yeah. Oh,
I
sure.
responded from my experience, but what is there like an age limit or max for the range of like the Camden scholars or anything like that?
Yeah, so over 18, so adults, and then that's it. No age limit. So like this year, even with the focus on people who are dually eligible, our youngest person is like early 30s, our oldest person is like mid 70s. Yeah. Anything, Aria and Arcelis, I know you spoke a little bit about impacts you have in the program. Anything you want to add here just in terms of impacts or additional thoughts there? Totally okay if not, just giving you space.
I mean, I would agree with you. I think for me, and like with my son, like he's younger, so he's 10, and so as I think through like, some of the things that he has, maybe things that may continue through life and they may present challenges as he gets older. I know like I haven't traveled with him to the conference, but I've traveled with him on my own. So like when we went for the Make-A-Wish trip, there is a lot of like anxiety. Like so the Make-A-Wish trip was the first time we ever got on an airplane and stuff. And like thank goodness for Make-A-Wish because they are the ones that like arrange all that. They set you up with TSA. They like do all that. And like I'm the mom that's like, explain to me how you guys did this. Explain to me how this works. How did this like and so then it made me feel capable as a mother that like, okay, like I can go travel and visit my brother in North Carolina and take my boys on a plane and it is capable, like I am capable of doing those things with all of this medical equipment and all of his supplies and having to go through TSA. And so I think there's I think for some people like and I can't speak for our groups, but I'm pretty sure Evelyn's probably had this experience where like people that she's probably or have interacted with, this probably was just the first time they got on a plane because they didn't know that it was
Definitely.
capable and like just all that comes with that. And so I think when you have someone to walk alongside you in that, it definitely helps encourage you and it helps show you that like you aren't as limited as you may have even thought yourself or like I think that also when you have conversations in groups, ideas and things come up that like you may not have been able to have on your own, right? Like and people's other experiences kind of trigger thoughts. And so I think that that's the beauty of like so many people with so many different lived experiences that, I mean, and even like there was a time where the young lady who had the communication device, like I remember her saying, she was just like, and I'm just grateful that my mom always pushed me so hard. And so like it just encouraged me, like, okay, even though he gets irritated, I'm gonna keep pushing really hard because when he gets older, he's gonna like, this woman's like a living testament to it. So like just those things I think are very, and like, are unintended, like, in some ways, I think they're unintended, like added value to the group.
So
No, thank you for that.
Oria said almost everything. I think that I would only going to add that when I left the first time that I was there, I left with a sense of really connection and community. And also that will that helps me, like not only growing up, but the hope that makes me felt inspired by others' stories.
Thank you for that. Yeah, so really can't add anything more to what you guys said, but we do an evaluation of the Consumer Scholars Program every year. So we hear kind of as major themes, that I think for a lot of people, like this program gives them language for what they already understood and were already doing. And I can relate to how that can be really powerful. Like I was working in nonprofits and social services long before I went to school for like a public health degree. And when I was in school, I just kept being like, oh, I didn't know there was like a word for that. Like I didn't know that was like a thing. And I feel more equipped. And I think other people have that kind of same experience with, they're like, oh, I'm an advisor using my lived experience, but like no one has like talked about it in, these certain ways, or to hear experiences of other people in the group and the work they're doing or the way they're navigating, their personal lives and medical issues and family stuff and all of that. I think it just provides like a frame of reference. A lot of people do say the program does help to make that jump, which is intentional between, the work they're doing locally or state level to a national community. Like I remember one person, it was a long-standing, I think she had been part of her hospital's PFAC, Patient Family Advisory Committee, for 15 years. And she was like, I didn't really understand that other hospitals had PFACs, or like this was like not just some super specific thing that was happening in my community. This is like a thing that happens elsewhere. And like, why aren't we all coordinating? And why isn't there like a network to bring us together? And so I think sometimes it's eye-opening for people just to realize like, no, this is lots of people are plugged in, but there's a lot of disconnects between all the iterations of how community engagement happens. And then yeah, connections I think are one of the biggest things, like personal relationships, ongoing professional relationships, connecting to other organizations, like just feeling better connected. Like I think both Ari and Araceli, as you mentioned, personal connections is part of what you experience, and that's what we hear throughout. So the last thing I'll speak to, and then it looks like we'll definitely have some time for just conversation and Q&A. So it's just like if I wanted to zoom out for a quick minute and just think about big picture, like some of the lessons we've learned from the program. First and foremost is like relationship building is the center. And I mean that in a lot of ways. I mean that number one, like, I think some training programs miss that piece. And it's like, just this kind of transactional opportunity. You show up, you get education, you get your certificate, see you later. But I think the relationship building, the cohort model, the group model, the like being together through an experience is something that I think a lot of the consumer scholars find value in, and something that facilitates learning. I also mean relationship building at the center in terms of like how I approach the work, and like what I think is so central to community engagement is like, I think one of the things that's hard about community engagement is that when you're showing up to work, so if you're me and you're showing up and clocking into your job, and you have your neat, clean little I'm here at my job professional hat on and all the messy, complicated parts of my life, I don't bring that to work. But then you're working with people who, by virtue of them being there, are there to discuss the really hard parts of their life, their, medical conditions, family stuff, trauma, like all this hard stuff. If you approach community engagement as a professional where you're like, well, I'm just going to keep this professional and keep my neat, clean little, professional self hat on, but I'm going to be immersed in all these people who are bringing them their full selves, it is always going to be a disconnect. People are not going to feel safe with you. And so there's a ton of work that I've done. And I think anyone who's working in community engagement has to do to think about like, how do I bring my full self? How can I be authentic? It doesn't mean I have to get rid of what my boundaries are and what I do and don't share, but how can I be a full person with other people who are being full people with me? And just like centering and building relationships is something I love about this job. But like, if you don't want to do that, community engagement, I think is like a hard thing to try to do professionally, because it is about people. It is about really caring about people and getting to know people, and honoring and valuing their like vulnerability and honesty that they bring. Um, I think, I mentioned this before, but like, just like the time and the space to be reflecting on what you're learning and thinking, and this relates to the next bullet around how you're iterating, how you're like actually integrating what you're hearing. And it's like gets a little meta, because that's the point of community engagement, is like, if you think about, we're designing this healthcare program, but we want people with lived experience to weigh in so we can make the program better. But we should also be making sure our community engagement process is better. And we're thinking about, how do we support people in sharing their stories? How do we compensate people? How do we navigate issues of accessibility? Like, we should also be asking people, how's this process going? And how can we get better at doing that too? I think related to learning by doing, just, navigating accessibility and accommodations. And I think the big word for me here is like flexibility. Like, you need flexibility in your programs, and a lot of things aren't set up to facilitate that in the world that we live in and the way funding works for health and social care. Flexibility can be hard. But that's like so essential as we think about, the group of consumer scholars. People are just coming from so many different backgrounds and orientations and abilities and disabilities and needs and all of that. And we're just constantly having to think about like, okay, how are we going to do this? And how can I meet you where you are? And like, how do you operationalize a concept like meet people where they are is something that comes up all the time. And then the last thing I'll say, and I'll give Ari and Araceli a chance if there's anything you want to add just in terms of these bigger picture lessons, although you've, I think, talked to this already. The last piece is just that like the diversity of the consumer scholars group is like asset capital letters double underlined. I mean, it's, I think, so beautiful. People come from sometimes very specific. They're like, oh, I've just been in like the cancer advocacy world. All everything I do is like with other folks who are cancer survivors. I'm like, I never thought about, substance use or homelessness or living with HIV or children with complex needs or, I had no idea what that was like, but we have so much in common. And people, just from all different walks of life. It's so eye-opening for me. I think for the groups, it's so eye-opening. Diversity is so great. And it's really hard to do. It's really hard to do. And I think sometimes in our like love and appreciation of diversity, we don't acknowledge that it's really hard sometimes to bridge generational divides and geographic divides and culture divides and different perspectives. And that there's like work and patience and mistakes and repair that all have to like go along with that. Um, and that you also have to have things like flexibility and humility. And there's like all this stuff that you have to account for. Like diversity is wonderful, but it is hard to do. And there's challenges every single year that come up in bridging some of those divides, but it's still so worth it in the end. So those are just like kind of my big picture reflections. So I'll see if Aria Araceli has any last thoughts, and then we have some time for questions or conversation.
I would, like when I think about what you talked about, I didn't say this at the beginning. So I work at a Christian nonprofit. I'm a director of people and culture. And we interact with all kinds of people. So we deal with food inequity in a very unique way. So we're a grocery/thrift store, and we have people that volunteer with us on top of employees. And so they work alongside the employees, and they're able to earn store credit to then buy whatever they want in the thrift store while they're volunteering with us and on their credit account. Turn that down, baby. Set the cat in there. Thank you. And so taking the skill sets that I've learned here and the things I've learned at work, I think one of the things that Evelyn really hit on is the relational piece. Like, I think sometimes we think of relationships or we think of like serving people in just like, in a certain way, like generally in America, it's a material way, rather than like a relational way. Because like people can be like relationally impoverished and not have community, not have people to walk alongside with. People can be like they can also be lacking in the way in which they just have understanding or knowledge. And it may not be like they have a learning disability, they just haven't been open to that, right? And so I think the way it's really helped me shape the way in which I see things. I think also too, like coming from and Naomi probably would agree with this, coming from like a mom caregiver and like you have a child with complex medical needs, we are kind of sometimes the last people that are thought about. It's like they think about the kids, and like let's take care of the kids, and it's not really like the whole family, but it's like all of it impacts the entire family. And so I love like being a part of the Consumer Scholar Program and like just staying connected with them and just seeing how things have changed from when I've even started to like this conference. And me and Evelyn were just talking about this. Like, there's a whole like family, kid, caregiver, like thing going on at this conference that they didn't have at any others. And so, like, the very first conference I went to, there was like barely anything about family caregiving or kids. It's always about adults. And usually that's where they start at, which is fine. I understand it's less complex. Like, the child's the one with the need, not the parent. And so it adds another dimension to things. But I just love how even the Camden Coalition has like reevaluated that and looked, and they're like, you know what, like this is a need. And like those kids turn into adults with needs. And those are the people that are going to begin to serve. So like, let's see how we can implement all of it. And so I think, just to kind of agree with Evelyn. Like I just love the approach and like how it really is like let's really grow and change and make it better for everybody.
Said the cat.
Thanks for that. Any questions, comments from the group or Araceli, if there's anything you want to jump in with, feel free, but otherwise we'll just open it up.
No, I just want to say something else is that I am at the office and it's a lot of background voices here. So I'm gonna try to make it quick. Um, I just also want to share that the first time that I went to the conference, and let me tell you that I have been to many conferences. I just came from USCHA and I was on a stage talking with Dr. Fauci. And I was like, oh my goodness, and it was like 1,000 people. But Evelyn, I do appreciate the work that you do. And this consumer score is something different because you go thinking that you have a huge problem, that you have something that is really like, oh my goodness, I have this or this is killing me. And then you meet people and you become more humble because you meet people that you say, oh my goodness, they are like dealing with more stuff than I am. And look at them. And they are happy and they have smiles on their faces. The first time that I got in the meeting with all these people, Evelyn, I wanted to cry. I really wanted to cry because I say, oh my goodness, look at all these people smiling. My spirit got lifted. I was like in another world, and I say, oh, I need to continue being part of this movement because this is a powerful, powerful movement. And it's teaching people that like somebody wrote here, have, it's not disabilities, are abilities. Thank you for writing that R. It is. And it gives you power. You feel empowered. You feel loved. You feel like you can do more things. So again, Evelyn, thank you. I'm looking forward for this and all the work that everyone do is valued by me, and I know that we're doing this with a heart full of love. Thank you.
Thank you. Naomi, did you want to jump in? You run the show. You don't have to raise your hand around here.
I, I wanted to ask a question that is often comes up. Well, there are two things. One that you mentioned in about as a quote unquote professional coming into this space with people with lived experience and knowing that it's not always going to be nice and neat. So how do you suggest those that are in a healthcare system or researchers or funders and who are really wanting to do that authentic community engagement, but also have to be willing to give of themselves, where it's a we and not a us and them.
Uh, Yeah, I mean, first is like understanding that. Like, I don't think everyone inherently understands that. And I don't think I understood that, at first. That that's like one of the competencies you need if you're going to work in community engagement is like that like relationship focus and like what it's going to look like. It's not the same as service delivery where you're in like there's like a power imbalance, where you're the service provider and you're helping this person and it's one directional. And then it's also not the complete opposite where you're just saying like, oh, person with lived experience, how can you help me do my work better? Like there has to be an equal give and take, and that looks a little different in each situation. And then I think like the other part of that is that like that you have to think about hiring people who are a good fit for jobs. Like, more and more these days, and healthcare is guilty of this. They're like, you have 47 different responsibilities, and it's unlikely that any human could really be good at all of those, but feel free to try. And that's why I think it's great. Like some people have folks who are like a community health worker role or a peer specialist role who support community engagement, love it. Or you hire folks that are interested in relationship building, that are comfortable navigating personal types of details, and so I think it's like a mix of like the setting the expectation, understanding the context, and then hiring people who are going to be a good fit or thinking about who are the roles within your organization or who are the people within your organization that are going to be comfortable doing that and able to.
Also, to piggyback off of Evelyn, with like hiring, right? Since I do hiring for my organization, like I really have been coaching. So like our employees work alongside volunteers. So like an entry level employee that is like that is processing donations, they also could be coaching a convicted felon that has community service, or they could be coaching a business leader in the community that has came in here to volunteer. And so for me, it's like how like I can teach you a skill set. I can't teach you to be kind and to love people. Like you have to be able to love people. And so it's really like asking those questions in the interview process, like what makes you tick? Like why do you want to be here? What makes you want to do this work? And I think hiring right for those positions is really the key. And also hiring people that I think it's easier that, and this is just like my bias, I think it's easier to be more understanding of people's situation when you're willing to like accept your own situation and be under like, give yourself grace. And then you can give that to other people. It's hard to give something that you don't have yourself, right? And so I think that those are big things like when you're hiring people and like when you're talking with people in this space or even in any space that you're really working with people in a way that's engaging and like you're dealing with people's stories and things like that. I think that that's the way that I've found to be beneficial and it's helped our team's culture and it's helped the volunteer interactions and things like that. So,
Yeah, thank you for that. And I see, Harv, you have a couple questions in the chat. We might only have time to get to one, but do you want to pick whichever one you'd prefer us to start with? We can maybe send a quick response to the other by email, but if you could maybe just expand just a little bit on whichever one you want us to speak to.
Uh, I guess in today's society where we have so much discord, uh, how I'd like to hear from the scholars how they may have had to deal with community pushback because being a retired PFAC member and a healthcare provider myself, I'm very familiar with the work of Camden Coalition, having had a dental practice in Philadelphia. But to deal with those that are not so supportive of all of your efforts and your patient voice. Thank you.
Let me answer quick to that. Even in social media, the other day I put a picture of me and Nancy Pelosi, and I got a message. How dare you are close to that bitch, and those are political views, and people are gonna be racist, homophobic, xenophobic, everything, and how I deal with that, even the stigma against HIV. How I deal with that is focusing on my goals, I'm sorry, the phone is ringing here, on my goals and what I want to do with a passion, and knowing that whoever is criticizing because they don't agree with what I do, it's not my problem. So I just ignore and keep doing my job because this is what I love, this is what I like, and I know that there is a lot of people who's going to benefit. So I really don't care about other people's thoughts against what I do.
I think a skill that I've learned, especially in HR, is just like being willing to sit in the tough conversation. Like there's times where I'll start with people and I'm like, look, like not necessarily corrective action, but just in the conversation, like, look, what's the goal of the conversation before we dig into this? Like, are you trying to change my mind? Because that's not going to happen. And nor am I trying to change your mind. Like, if we're just going to give each other information, I'm here for that. We can do that. And then you can marinate in it and I'll marinate in it and we can come back for another conversation. But I think like being able to like do that and decipher and just have the tough conversation. I mean, for me, like I feel like HR is like nothing but tough conversations most of the time, whether it's like a hygiene issue, whether cash is missing out the register, whether someone's cut somebody out, whether whatever it may be. It's like I have just came to just deal with the fact that like I will have tough conversations all the time and I'm okay with it. I will be awkward in some and I won't be in some other ones, but at some point that tough conversation won't be tough anymore to me. It'll be a different conversation. And I think also like, when I think one thing that I'm able to do really well in my professional life that I'm working on in my personal life is like like I can detach someone calling me a bitch because I wrote them up because you don't actually know me. Like you're that's internally. That's you. Like you're upset about you. And I think like being able to do that sometimes is important. Like being able to be like, okay, that actually they don't even know me well enough to know or like to be able to respond to me that well. And I think it takes like a surety in yourself that like I've had to get to. And I've kind of had to just be like, okay, like am I a bad mom? Am I this? Am I that? I'm none of those things, so that doesn't apply to me.
Thank you. Thank you. Those are great questions. I want to say thank you. I know we're right at time. Thank you, Aria and Ari Celis and Eveline, for bringing information about the National Consumer Scholars and how to work with people with lived experience and how, Aria, you said it best, I think too, where you said you come in with your own biases. And so that's one of the things for us to recognize as we're working with, we all have our own lived experience and bias. One last plug, want to make sure that if you're available, please join us at Putting Care at the Center 2025 conference that's happening in Portland, Oregon. Next month, there are still seats available, not many, so meet us there. And the National Consumer Scholars, there were and people with lived experience that did help with the planning piece of this. So you definitely don't want to miss the session. We look forward to seeing you at our regular session at the end of the month, September 26th. You all have a fabulous Monday, a great week, and we'll talk to you later. Have a great one.
Thank you all. Bye-bye.
Bye.
Bye.